Hello everyone, I'm Dr. Sienna Miller. I'm a naturopathic physician and I specialize in dermatology. Today I'm going to be talking about constipation and some foundational interventions you can implement if this is something you're struggling with. I want to put a disclaimer out there that this is not a substitute for medical care. If you're struggling with constipation, I recommend seeing a qualified healthcare practitioner for evaluation and management. This is not medical advice. This is not me telling you what to do. This is just providing education. As I've said before, there are contraindications to absolutely everything in life, even water. So make sure you talk to your healthcare provider if you're wondering if any of these things are unsafe for you to do. I want to start with the foundations. As I learned in school, we call these the 4 F's, and those are fluid, fiber, flora, and fitness. So first is fluid hydration, meaning water intake. You want to make sure you're getting plenty of hydration every day. Your body brings water into the bowel and that helps kind of soften up the stool and keeps things moving, so hydration is essential. A good rule of thumb is to drink half of your body weight in ounces. So for example, if you weigh 150 pounds, your goal is to get 75 ounces of water every single day at least. Next is fiber intake. I will never shut up about fiber. It is, in my opinion, like the best thing you can focus on increasing in most cases for most people. It is just so extremely beneficial for overall health. But I digress. So by fiber, I mean focusing primarily on vegetables, number one, increasing your vegetable intake and getting a good variety of vegetables. And then you can sprinkle in there fruit, nuts, seeds, beans, legumes, herbs, and spices. And then of course, whole grains are on there as well, which is what a lot of people think of first when they think of fiber, or like a fiber powder. But I'm trying to change thinking so people, when they hear fiber, they first think about vegetables. So that is the main goal in thinking. You want to increase your vegetables, but then, try to get all of those other things in there as well. The goal is 30 grams of fiber every day and then 30 different types of fiber every week to support a healthy microbiome diversity. Next is flora, or the microbiome, so like the good healthy gut bacteria. Of course, you want to start with focusing on getting a good amount of probiotic rich food in your diet. So we're thinking like sauerkraut, yogurt, kimchi, miso, pickled things, kombucha, gotta be careful with because it has brewer's yeast in it and that can sometimes make fungal issues worse, but it technically has probiotics in it as well. And then oral probiotics, I'm 50-50 on. Some people need them and other people don't because they have more of an overgrowth pattern. So I think number one is just focusing on getting probiotics in the diet and then making sure you're getting plenty of fiber to feed the good bacteria. And then fourth is fitness. So making sure you're living an active lifestyle and getting plenty of movement. I recommend for some people getting some light movement or going for a walk after dinner because it helps support peristalsis and blood flow to the intestines. Of course, you don't want to do any intense aerobic exercise, but just some light movement. Walking is a great example, like I said. So those are the foundations of supporting healthy bowel movements. I never recommend adding anything else, supplements, medications, nothing until all of those things are in check. Once all of those things have been implemented and you're still struggling with constipation, I'm going to talk about the next tier of things you can try. So sometimes I'll have people add on a fiber supplement, so either in capsule or powder form. Some examples of common over-the-counter fibers are psyllium husks, so like metamucil. Acacia fiber is another really common one. Partially hydrolyzed guar gum. Those are common examples. 2 nutrients that are really beneficial for constipation. The first is magnesium. So obviously trying to get more magnesium in the diet is helpful, but adding on like a magnesium supplement can be really nice too to help get bowels moving. The next is vitamin C. Vitamin C can also be really helpful for constipation. So I usually have people start one or the other and then kind of slowly taper up until they're getting to a place where they're having regular bowel movements every day. All right, I hope that was helpful. Again, like I said, if you're struggling with constipation, I recommend going to see a qualified healthcare practitioner to figure out what the underlying cause is. There's lots of underlying causes of constipation that I will test patients for. So that usually includes like blood work, stool testing, breath testing, and sometimes referral to gastroenterology or ordering imaging. But usually, like regardless of whether I'm ordering those other things, I'm counseling in people to start with the foundations that I mentioned. And then if I'm gonna add in anything else, I'll do like a fiber powder, magnesium, or vitamin C. So I hope that was helpful. Let me know if you have any questions or any video requests. Give this video a thumbs up if you enjoyed and subscribe to my channel for similar videos. And I will see you in my next video. Bye.